In this video, we are going to discuss about MTP. So, MTP Act is actually passed on 1971, okay, and actually it is proposed on 2nd March 2020 recently. So, MTP Amendment Bill was introduced especially in Lok Sabha. So, in Lok Sabha, it is introduced in 2020, and on March 17th, 2020 the bill is passed but yet to become a law. Okay, so now coming to recommendation according to this, there is let us see the recommendations according to this old 1971 and the new 2020. So according to old 1971, the product of gestation at which the MTP can be done in India is till 20 weeks. So till 20 weeks you can do MTP, and the opinion of second doctor, let us compare first. The MTP can be done up till 20 weeks, but now according to the new recommendations, the MTP can be done up till 24 weeks. So in the old act it is according till 20 weeks, in the new act it is till 24 weeks. So in the previous time they used to take two opinions of opinions from two doctors, and that is also till either 20 to 20 week. And now they are saying to take opinion of two doctors from 20 to 24 weeks. And now coming to in severely malformed fetus, MTP can be done till at that time they used to say we should do only till 20 weeks with severe malformation fetus, and now they are saying there is no restriction of age at which MTP can be done. It should be certified by a medical board, then you can do without any restriction in the new act. Okay, so these are the things which we need to consider. Now coming to the methods of MTP. So the methods of MTP in the case of first trimester, we do MC, that is medical abortion, which is an OPD procedure, no need of admission. And next, in the first trimester we can also do suction evacuation using Karman cannula. And next there is manual vacuum aspiration with MVA syringe. So these are all the procedures which we need to do in first trimester. Coming to the second trimester, here also you can do the medical abortion, which is the most common, and it needs the admission here. So in the second trimester you need the admission. In the first trimester it's an OPD process, and the drugs which we use in the second trimester is misoprostol. We use misoprostol, which is PGEI. It's most common extra amniotic. Okay, it's actually most common. It's extra amniotic and ethacridine. Intra amniotic is let me write it. Extra amniotic is ethacridine. Intra amniotic is hyperosmotic saline, and also oxytocin can be used. Next, coming to dilation and evacuation using ovum forceps, which is followed by blunt curettage. Next, open uterus, that is hysterectomy, but of course it's not done. Open uterus. So these all procedures we do in the second trimester. Next, coming to ovum forceps. Ovum forceps is a spoon shaped forceps, and there is no ratchet lock at the distal end. Now coming to medical abortion, MA. So medical abortion, according to WHO, it says it can be done till 9th week, but according to India it is done till 7th week. And before doing medical abortion, we need to say that the urine pregnancy test is positive, and USG is not necessary in this case, and even no admission. It's an OPD process. No admission, it's an OPD process. Now coming to the method. First, on the day one, we used to give mifepristone, that is 200 milligram one tab. So let me write it. So day 1 we give mifepristone, which is given orally, that is 200 milligrams one tab, and followed by day 3 we give isoprost, which is 400 micrograms, which can be given either orally or vaginally, but vaginally is most preferable. As per WHO, should give 800 micrograms, but in India we give 400 micrograms, and the abortion occurs most commonly on day 3 itself. Next, coming to day 14. On day 14, we need to check if it is complete clinically, and also by using USG. For medical abortion, USG is not necessary for any step. If some product of conception are retained, if still something is retained, then we go for blunt curettage. But this is also seen only in 1% of people, almost it would be going. Now coming to suction evacuation. In suction evacuation, it is done from 7th week to 12th week. It is mainly done by using Karman cannula. Internal os is dilated using Hagar's dilation. So first we use Hagar's dilator and dilate the internal os, and next we'll use the Karman's cannula, and this is a plastic Karman cannula, have two triangular openings, and the size of cannula is equal to the period of gestation, and the pressure is generated in this as 600 pressure generated 600 millimeters of mercury, and the end point is suction evacuation. Now coming to air bubbles. If air bubbles are seen and bleeding decrease and grating sensation, so after this check using blunt curettage. Now coming to complications. Perforation of uterus at the time of dilation using Hagar's dilator. Wait and watch. Monitor the vitals of patient with Karman cannula while doing suction. Stop the procedure. Do not take out cannula. Immediately take the patient for exploratory laparotomy because it's a dangerous case. Intestine may come out. In the rural areas, the alternative for suction evacuation is manual vacuum aspiration. It's a syringe with two pinch valves. It uses Karman cannula at proximal end. It's done up till 7 to 12 weeks. Okay, and the syringe is like about 60 ml. The pressure again here also 660 millimeters of mercury. Next coming to POG, period of gestation, and MTP. Period of gestation, if it is less than 7 weeks, the best method is medical abortion. If it is from 7 to 12 weeks, there is suction evacuation. If it is greater than 12 weeks, it's misoprost. Admit the patient, and 400 micrograms give for hourly vaginal, maximum 5 doses, and generate contractions called as mini labor. Now coming to partner's consent is not necessary for MTP. So no need of partner's consent in the case of MTP. MTP can be performed by registered medical practitioner and assisted with 25 MTPs, or which has done as primary surgeon, that is an RMP with 25 MTPs and 5 primary surgeries, and RMP with 6 months training in OBS and Gynae, and DGO MS in gynecology, DNB in gynecology. All of them should do this procedures. So lastly coming to MTP Amendment Act. Actually MTP Amendment Act is 1971, as we discussed about all these things, right? According to MTP can be done by medical practitioner approved by government, okay, who has done 6 months house job, at least 25 MTPs. So actually the medical indications are like continuation of pregnancy might endanger mother's life, for example heart disease, end stage renal disease. In that case we do MTP. Eugenic indicators like a continuation of pregnancy can lead to birth of a fetus with serious physical or mental abnormalities like anencephaly, rubella in the first trimester. Humanitarian cause like incest. Socioeconomic cause as unplanned or because of contracept failure or other important points. Like you can see all this, like it's very simple. So that's it about MTP.